We were 3 days away from our dream trip to Scotland when I discovered something that made my blood run cold. Medicare doesn't cover you outside the United States. Not a single doctor visit. Not one hospital bill. Nothing. My husband and I had spent months planning this trip. We'd booked the flights, reserved the hotels, mapped out every castle we wanted to see. But we'd completely forgotten about one crucial detail. Our health insurance wouldn't work there. This isn't just our story. Thousands of retirees make this same mistake every single year. They board planes to Europe, Asia, or South America thinking they're covered. Then something happens. A fall. A heart issue. A sudden illness. And they're stuck with medical bills that can reach tens of thousands of dollars. Here's what makes this even worse. Most people assume Medicare works everywhere. After all, you've paid into it your whole working life. You've earned those benefits. But the fine print tells a different story. Medicare only covers you in the United States and its territories. That means Puerto Rico, the U.S., Virgin Islands, Guam, American Samoa, and the Northern Mariana Islands. Everywhere else? You're on your own. Now you might be thinking, what about Medicare supplement plans? Don't those cover international travel? Some do, but Teresa catch. Most Medigap plans only provide emergency coverage outside the U.S. And even then, it's limited. Let me break down what typical Medigap foreign travel coverage looks like. First, you have to meet a deductible, usually around $250. Then the plan covers 80% of emergency care. But here's the kicker. There's a lifetime limit of $50,000. That might sound like a lot of money. But medical emergencies abroad can get expensive fast. A hospital stay in London can cost thousands per day. Emergency surgery in Paris? Easily $20,000 or more. Air ambulance back to the United States? That alone can exceed $100,000. So what happened with our Scotland trip? We almost canceled everything. We'd already paid for non-refundable flights and hotel deposits. Losing that money would have been devastating. But going without proper coverage felt like playing Russian roulette with our retirement savings. Then a friend told us about travel medical insurance. I'd never heard of it before. Turns out, it's specifically designed for situations like ours. Coverage for medical emergencies when you're traveling internationally. Travel medical insurance isn't the same as trip cancellation insurance. That's important to understand. Trip cancellation insurance reimburses you if you can't go on your trip. Travel medical insurance covers you if you get sick or injured while you're there. The cost surprised me. For our 3-week trip to Scotland, comprehensive travel medical insurance cost us less than $300. That covered both of us. Emergency medical care, hospital stays, prescription medications, even emergency evacuation if needed. Compare that to what we could have paid out of pocket. A broken hip in Edinburgh could easily cost $40,000. A heart attack requiring hospitalization? Over $100,000. Suddenly $300 seemed like the bargain of the century. But here's what most people don't know about buying travel medical insurance. Timing matters. You need to purchase it before you leave the United States. Once you're already abroad, it's too late. Insurance companies won't sell you coverage when you're already on your trip. Also, pre-existing conditions can be tricky. Many travel medical insurance policies won't cover conditions you had before buying the policy. But some will, if you meet certain requirements. Usually you need to buy the insurance within a specific window after making your first trip payment. We learned to read the fine print carefully. Some policies have maximum age limits. Others exclude certain activities. If you're planning to go skiing, hiking, or doing anything considered adventurous, make sure your policy covers it. Another thing we discovered? The importance of 24-hour assistance. When you're dealing with a medical emergency in a foreign country, you need help navigating the healthcare system. Good travel medical insurance includes access to multilingual support staff who can help you find doctors, arrange hospital admissions, and coordinate care. Now let's talk about what actually counts as an emergency. This is where things get complicated. A sudden heart attack? Definitely an emergency. A flare-up of your chronic back pain? Maybe not. Insurance companies define emergency as a sudden, unexpected medical condition that requires immediate treatment. That means if you run out of your regular medications, travel medical insurance probably won't cover getting refills. If your arthritis acts up and you need to see a doctor, that might not be covered either. The policy is designed for true emergencies, not routine care. We also learned about medical evacuation coverage. This was something I'd never even considered. If you have a serious medical emergency in a remote area, you might need to be transported to a better equipped facility. Or even flown back to the United States. Medical evacuation can cost anywhere from $10,000 to over $200,000. Most travel medical insurance policies include this coverage. But again, check the limits. Some only cover $50,000. If you need air ambulance service across the Atlantic, that might not be enough. During our research, we found out about annual travel medical insurance policies. If you travel internationally more than once a year, these can save you money. Instead of buying a new policy for each trip, you are covered for multiple trips within a 12-month period. There are usually some restrictions though. Each trip might be limited to a certain number of days, often 30 to 90. And you still need to be primarily living in the United States. But for active retirees who love to travel, annual policies can be incredibly cost-effective. We ended up going to Scotland with full travel medical insurance coverage. And you know what? We needed it. My husband slipped on some wet cobblestones in Edinburgh and badly sprained his ankle. We had to visit an urgent care clinic. The visit cost about £200, roughly $250. Our insurance covered it completely after the deductible. But more importantly, the insurance company's assistance line helped us find an English-speaking doctor quickly. They coordinated everything. We didn't have to fumble through trying to navigate a foreign healthcare system on our own. That experience taught us something valuable. Travel medical insurance isn't just about money. It's about peace of mind. Knowing that if something goes wrong, you have support. You're not alone in a foreign country trying to figure out where to go and how to pay for care. Since that trip, we've never traveled internationally without proper coverage. It's become as essential as our passports. We budget for it just like we budget for flights and hotels. Because we've learned that the cheapest trip insurance is the policy you buy but never need to use. Let me share some practical tips we've learned. First, buy your travel medical insurance as soon as you book your trip. This gives you the longest coverage period and the best chance of coverage for pre-existing conditions. Second, carry your insurance card and emergency contact numbers with you at all times. Put them in your wallet, your phone, everywhere. Third, understand exactly what your policy covers before you leave. Read through it carefully. Know the deductibles, the coverage limits, and what counts as an emergency. Fourth, keep all receipts and medical documentation if you need care abroad. You'll need these to file claims. Fifth, contact your insurance company before seeking non-emergency care if possible. They can direct you to in-network providers or approved facilities. This can save you money and hassle. Sixth, consider adding trip interruption coverage. This reimburses you if you have to cut your trip short due to a medical emergency. The bottom line is simple. Medicare won't protect you when you travel internationally. You need separate coverage. And the cost of that coverage is minimal compared to the financial devastation of an uncovered medical emergency abroad. Don't make the mistake we almost made. Don't assume you're covered. Don't think it won't happen to you. Medical emergencies don't care about your vacation plans. They happen when they happen. And when they do, you want to be prepared. Your retirement dreams shouldn't come with the risk of bankruptcy. A proper travel medical insurance policy ensures they don't. It's one of the smartest investments you can make as a traveling retiree. Because the world is meant to be explored. And you should be able to do it without fear.